Good morning everyone, I am Dr. Sara, Clinical Geneticist at Rainbow Children's Hospital. I will be speaking about genetic conditions. So genetic conditions are caused by changes in the human genome. Depending upon the size, location and type of the change, genetic conditions are broadly classified into chromosomal disorders, microdeletions, monogenic conditions, multifactorial conditions, methylation defects and the triplet repeat nucleotide disorders. I will be speaking a little bit about the monogenic disorders. So monogenic disorders occur when these changes in the genome occur in one single gene at the DNA codon code level. And these changes can be, depending upon the mode of inheritance, are further classified into autosomal dominant, autosomal recessive, X-linked dominant, X-linked recessive. Now the autosomal dominant conditions are conditions wherein one single allele change can cause the disease to manifest. And the autosomal recessive conditions are the conditions wherein two gene allele changes manifest the condition. Examples of autosomal dominant are achondroplasia and Marfan syndrome, and examples of autosomal recessive are thalassemias and spinal muscular atrophy and most of the inborn errors of metabolism. Achondroplasia should be suspected in children with disproportionate short stature as well as short limbs, and Marfan syndrome should be suspected in children with tall stature, with vision and heart issues. And thalassemias usually present with recurrent need of dependency for blood transfusions as well as splenomegaly. Spinal muscular atrophy is a condition wherein there is progressive muscle weakness in the child, and inborn errors of metabolism are conditions wherein children have failure to thrive, developmental delay if the appropriate diet is not started at the right time. So over here, depending upon the allele changes, the manifestation of the disease and the mode of inheritance, so these is the classification difference, that is the autosomal dominant and the autosomal recessive conditions. Next would be the X-linked recessive and the X-linked dominant conditions, and this is caused by changes in the X chromosome. So as we know, X chromosome, females have 2 X chromosome and males have 1 X chromosome. So depending upon the change in the allele, the disease manifests as X-linked recessive or X-linked dominant. In the X-linked dominant conditions, it's usually one allele change where the disease is manifesting, and usually this is seen in females, and males it is very lethal, so they don't manifest. And in the females, examples would be X-linked phosphatemic rickets, and over here the mutation occurs on the FEX gene, and another example would be the Rett syndrome, which is also manifesting in females because it is lethal in males, and these are X-linked dominant conditions. In Rett syndrome, it's mostly de novo and not inherited from a parent. Now moving on to X-linked recessive conditions. So over here, these diseases manifest mostly in males. Females are mostly carriers of the condition, which means they will be asymptomatic and pass on this gene to their sons. An example of this would be Duchenne's muscular dystrophy. Over here also there is progressive muscle weakness in the lower limbs, wherein the child finds it difficult to walk, and appropriate testing after history taking an examination helps the family with a diagnosis. So monogenic conditions should be suspected in children with disproportionate short stature, global developmental delay, intellectual disabilities, anemias with dependency on transfusion, as well as inborn errors of metabolism, and several more conditions like multiple malformations. Why is recognizing the need for genetic testing important? Is that the appropriate timely diagnosis helps family for understanding the type of disease, the natural history of the disease, to have a regular surveillance for the child for optimization of health, as well as for treatment and management options, as well as the family can make the appropriate reproductive choice by informed decision making in the future pregnancies by choosing the right genetic tests.